So in this session, I will cover a brief introduction to the framework, including how the framework was developed, what is included in the framework, how you can use the Lung Cancer Policy Network's accompanying online toolkit, and how to apply the framework itself. And I'll do a little bit more of a deeper introduction into the different aspects and considerations for screening implementation that the framework covers. So just to sort of highlight that as the implementation of targeted low-dose CT screening gains pace, as we heard in our introductory remarks at the beginning of the webinar, it's really important to optimise the programmes and how they're designed and implemented to ensure that they are able to deliver the impact on population health that we are all hoping for them to and intending for them to achieve. So to advance this, the Lung Cancer Policy Network has developed an implementation framework which is designed to support anyone involved in planning for and delivering or implementing lung cancer screening programs around the world to assess and understand their readiness for implementation. And we understand readiness for implementation to be the ability of a health system to rapidly and sustainably adapt policies, processes, and infrastructure to support integration of an innovation. And in this case, the innovation that we're talking about is low-dose CT screening for lung cancer. So what exactly is the framework to support the implementation of LDCT lung cancer screening? So the framework was developed drawing on existing frameworks in other disease areas and health areas, a thorough review of the published literature, as well as national and international guidance, and the expertise and contribution of the network members to develop this framework, which is specifically designed around implementation of lung cancer screening. The framework was then applied and refined to 5 countries around the world with different health systems where lung cancer screening is already underway to enable the framework to be refined. And the intention behind this process was to deliver a very robust and thorough comprehensive framework, which is now available and a really valuable and useful tool for those working through planning for implementation in their own health settings. The framework itself is designed to be comprehensive in that it incorporates 6 overarching domains that consider different aspects of planning for LDCT screening implementation. So you can see the different domains in the figure that's on the bottom of the screen, but I won't dwell on those too much now because I will go into a little bit more detail when we come to do a bit more of a walkthrough of the framework. Each domain is designed and can be used independently or as part of the full framework to help anyone using the implementation framework to assess and understand the key requirements for implementation, and it also helps to give a sense of where there might be any gaps that are currently existing and how those might be best managed when it comes to designing the screening programme. To support the use of the implementation framework, the Lung Cancer Policy Network has also developed a supplementary online toolkit, which is freely available. You can access it by going to the Lung Cancer Policy Network's website, and you can also download the framework itself from that website too. So the online toolkit is organised and structured with each page according to each of the 6 domains of the framework that you just saw on the previous slide. It's designed to help you engage with the sections of the framework that are most relevant to your needs and interests. So within each domain, you can find expert perspective videos featuring several of our network members where they share their expertise and experience of different aspects of screening implementation from their own experience in different countries. You can also find supporting tools that the Lung Cancer Policy Network have developed, including supplementary tables and fillable templates, which you can use alongside the application of the implementation framework to support you as you move through understanding those questions. And again, I'll go into more of the specifics around each domain of the framework in a little more detail in a moment. You can also find a really comprehensive library of resources that's been curated by the Lung Cancer Policy Network, and this includes, for example, guidance from different countries, publications and reports on lung cancer screening and implementation, all to help you identify some of the key considerations and begin to think about programme design for your own country. Once you download the actual framework itself, so you can download this as a Word document, and we've set it up in this way so that it's a really interactive document that you can then begin to work through as you're applying it to your own health settings. So the way that you can go about applying the framework to your health settings is by progressing through the framework, and each of the series of questions that the framework asks, which together enable a comprehensive assessment of readiness for screening implementation. You can also use the supplementary tables and reference tables and fillable templates that I just mentioned in the previous section, so you can help answer some of those key questions and consider where your country's at or where progress might need to be made to really prepare for implementing a high quality screening programme. I'll now spend most of the rest of our time together giving you more of a detailed introduction to the different aspects that are covered in each domain of the framework, to give you more of a sense of what you can hope to gain by applying and using the implementation framework. I also noticed that I've seen a couple of questions pop up in the Q&A. I will do my very best if there's time to answer those, but we will also be sharing, along with the recording of this webinar, a frequently asked questions. So please do share any questions that you might have. And if we do run out of time today, then we'll be very happy to answer those on our website. So the first domain of the implementation framework focuses on governance. So governance of the screening programme should identify who's responsible for all aspects of the screening programme, from planning through to delivery, and how relevant roles and responsibilities and accountabilities will be embedded into the programme structure. This is the case both for when you're in the planning stages as well as during implementation, and governance should be considered all the way from the leadership of the programme through to local delivery. This is something that one of our network members, Dr. Dorothy Keefe, has shared in her expert perspective video, where she's shared the perspective from Cancer Australia and the screening inquiry that was conducted there, where she speaks about stakeholder engagement and how the screening inquiry was designed to gather perspectives on screening implementation, including, crucially, how it could best be implemented from a very wide range of stakeholders, including administrators and those planning and managing different aspects of the Australian health system, through to communities who are at high risk of lung cancer, and therefore it would be really important to ensure and secure their attendance for screening. The experience in Australia also then informed how the screening programme is now being designed, and identified key considerations for that as well. So I'd warmly invite you to go and watch Professor Keefe's video and learn more from that experience in Australia. And that's just one example of one of the resources that is available in the online toolkit to support you as you work through this aspect of the implementation framework. Domain 2 of the implementation framework focuses on workforce and technical capacity considerations. For those of you who were in the earlier sections of the webinar, you'll have heard several different perspectives and really the emphasis of the importance of planning and preparing for the workforce and technical capacity requirements that the screening programme will necessitate. The workforce requirements perhaps a little bit more self-explanatory, and of course the technical requirements go hand in hand with the capacity in terms of the different different roles that will be required to perform and interpret the scans. So each country will need to assess its workforce capacity and the technical requirements to ensure that lung cancer screening can be operational within its health system. And this can also help inform decisions on where there might be, for example, capacity challenges, whether that be to do with, for example, the number of CT scanners or the number of different roles that are available within the screening programme. Working through the framework can also help you gain more of an understanding about different strategies that you may consider implementing to overcome some of those capacity challenges to ensure that a screening programme can still be implemented in a robust and high quality manner. Within the online toolkit, for example, you can find a reference table which helps you capture in a concise way all of the different roles and the capacity of the health system in that respect. And you can also watch an expert perspective video from Dr. Ante Marusic, who's based in Croatia, who shares their perspective of how they overcame some of the capacity challenges in primary care to implement screening out of hours, and some of the considerations and the reason behind why they took that, where they've achieved great success in implementation, having now had screening underway for a few years now. The third domain of the framework, again, I think this is something that in our panel discussion earlier was mentioned several times, is on financial planning. Several of our panelists earlier mentioned the importance of high quality implementation to help underpin the cost effectiveness of the programme. And I think this is particularly important, especially because screening programmes are a long-term endeavour, and they span several areas of the health system and health services. So making sure that the programme can be appropriately resourced and budgeted for over time is a really vital consideration. So by answering the questions in the framework, this can help you accurately anticipate the costs of implementing a screening programme, consider different financing options or considerations of how the programme might be financed, and also review and capture economic evaluations that may have taken place that might inform, for example, the model of screening implementation, or inform some of those discussions around securing the appropriate level of financing for the programme. Domain 4 of the framework, again, our panelists shared several thoughts around this area, around the importance of targeted eligibility criteria and recruitment methods for LDCT lung cancer screening. Many of our panelists mentioned the importance of securing participation of people who are at high risk of lung cancer and would benefit most from screening. And the framework takes you through several different ways in which this can be assessed. For example, and one aspect of the framework focuses on the application of risk models. But then once the eligible population is determined, it's important to secure attendance and recruit those eligible for screening into the programme. So the framework will help you consider how that process will happen, including which roles within the health system, for example, that may be primary care, will be involved, and how to engage those health professionals in the screening programme and in the recruitment process. But it will also help you consider the informational needs of those eligible and establish processes for recruitment, and consider how best to relay the appropriate information around screening so that people who are eligible can make an informed decision on their participation. And across this domain of the framework as well, a really key consideration which is embedded throughout this domain and indeed throughout the broader framework is implementing screening in a way that helps mitigate and manage existing health inequities in a way that also avoids exacerbating those inequities. So, for example, in terms of recruitment, in the expert perspective video, Professor Sue Krengle shares her experience of co-designing a research program that assesses the effectiveness of different recruitment methods with Maori communities who are at particular high risk of lung cancer and also of poorer outcomes from lung cancer. The fifth domain of the framework focuses on LDCT screening delivery. So in particular, on the development of protocols and also the integration of screening into and how screening will be followed up, for example, diagnostic workup, or where participants are called for follow-up following screening. So applying the framework can help with defining the screening protocol, establishing processes to monitor and manage quality. And it also goes into detail around the integration of relevant public health initiatives, including smoking cessation, and helps you consider different pathways that might include diagnostic workup or, as I just mentioned, participant follow-up. And you can hear from Dr. Joelle Fati sharing the experience of best practices and developing best practices that promote quality screening in the US, as well as example pathways on how to manage screening results, as well as other resources. The sixth and final domain of the framework is around data management and monitoring and evaluation of the screening programme. Screening programs can be very complex, and there's several inputs and many inputs and outputs in terms of data, which will require well-organized health information systems. So this is something that should be planned for from an early stage, but also to think about what kinds of data will be needed and ensuring the appropriate consent and similar considerations to enable that data to also be used to monitor and evaluate quality of the program as well. So it's essential to consider the types of data that will be needed or will be passing through the screening program, the levels of access that will be needed, including which roles within the health system should have those levels of access, establishing how data will be standardized and shared, both for the monitoring and evaluation, but also from a research perspective as well, and then planning for monitoring and evaluation of the screening program. So that was a whistle-stop tour through what you can hope to gain by applying the framework and the different domains that it considers. But really, by bringing all of the domains together and using the implementation framework, it facilitates a really robust assessment of the implementation needs for a targeted LDCT screening program. So the intention and what you can gain from using the framework is to understand readiness for implementation, which then helps you to generate a detailed plan for implementation, including where there may be gaps that exist or there's opportunity to optimize different aspects, that can be addressed and planned for from an early stage. This is also really useful to identify any specific policy requirements which can be used to support policy engagement activities, including advocacy for screening implementation. And also beyond that, to deliver a really robust and comprehensive assessment of the implementation needs, which can inform some of that more detailed, granular decision making. So with that, we very warmly invite you to download the implementation framework from the Lung Cancer Policy Network's website. It's freely available. And you can also explore the online toolkit featuring many of the resources that I've just mentioned and many, many more resources as well. In the coming weeks, we will be launching a series of policy briefs. So there'll be 6 policy briefs, each aligned with a different domain of the implementation framework. And that will enable you to gain a deeper understanding of some of the key considerations for implementation aligned with each domain of the framework, and also learn from implementation in several different countries through several case studies that will be shared through those. The Lung Cancer Policy Network also has a mailing list, so we'd warmly invite you to join that to stay up to date with our other work and publications as well. So with that, I'd like to thank everyone very much in advance. I'd like to once again thank all of our speakers from the first session in the webinar. You can interact with the Lung Cancer Policy Network through any of the means shared on the screen below, and we warmly invite you to download the implementation framework and apply it to your own health settings. We very much look forward to hearing any feedback that you might have about how that's gone. And finally, as I mentioned briefly, that any questions that you've kindly shared in the Q&A, we will respond to through our website in the coming weeks. So please do look out for that. And once again, thank you very much for your engagement and support with this webinar. It's been a pleasure to have you join us, and wishing you all a wonderful day. Thank you.